How's the culture?
Well, you worked there. Let me ask you.
Oh, that was a couple of years ago. I'm hoping it improved since then.
Did you? Yeah. I mean, I hear mixed reviews. Obviously, right? It's not a facility that's going to be for everyone. Um, so as far as the culture, I mean, I'm very transparent with people going over there for the first time because you're coming in and the full time staff is known for being, a little bit abrasive. I would say I always tell people, it's a very lucrative assignment. Um, especially if you have a passion for psych, you can definitely go over there and put your head down and get a lot of work done, make a lot of money, but you're not going there to make best friends. Um, it's just, there's a little bit of, I would say, favoritism, for lack of a better word, to those local full time nurses, when it comes to overtime or shift preference, things like that. Um, so I always try to just kind of paint the picture like if you're the type of psych nurse that can go in and, you're comfortable, you look at each patient and that's your goal is to provide the best care that you can for that patient. You go in each day, you do that, and you go home. You can totally crush out the 26 weeks, you know, put some money away and go on to your next contract. But if you're looking for, a desirable location with at a facility where you're, hoping to renew or extend or even go full time, I don't know that this would be my suggestion a starter as a starter contract, so to speak. So it just really depends on the person. I have very mixed reviews and opinions from both contractors and full time staff.
Oh,
To be honest with you,
so you're saying it's not really a long-term option?
it's not a long term option if it's something that you do. If you're if you're familiar with working in a forensic psych environment and you go over there and it works for you, you can absolutely. We have consistent needs for the facility, so you can typically renew and renew, and if they want to bring you on, they'll do that.
Yeah.
I would just say that's not the majority, right? Which is why they have a consistent need for travelers. Because I think a lot of people see dollar signs. They go out there, they make their money, and then they move on. But of course, there's a decent population of people who go out there and end up staying on board. Why is that something that you're looking for? You're hoping for a long term contract, or are you looking to go temp to perm?
No, not necessarily, but if a job is a poor choice for the long term, that sort of describes what the short term would be. And that was my experience
Yeah.
as well. I would call it a fairly toxic, abusive work environment. It's fairly
Oh,
hostile to
is that so?
travelers and also discriminatory. Not necessarily for any protected class, like federally protected class, the sex, the age, the gender. Those are certain federally protected class, but discrimination in terms of uh, from permanent staff against the temporary staff.
From patients or from full time staff?
From the full time staff, like a pitting,
Okay.
like the clicky high school drama, sort of.
Okay, so you know all about it. So you
Yeah,
just wanted to see what I was going to say.
yeah. Well, it sounds like your description is fairly similar to what my experience.
Is it accurate? Hey, at least I was honest with you.
Yeah, yeah.
No, I don't want to send anybody out there that can't handle it. And like I said, it's if you're looking to make, I mean, I can't speak towards some of the things that you just mentioned, but if you're looking to go in and work with people who and make friendships and long lasting relationships, it's just I tend to steer those people away from it because I see the people that are successful going over there, they put their head down. Um, they're concerned about the patient and the patient only. They don't really get involved in any of the, I guess, politics or, um, whatever's going on with the local staff. But I can understand how that might be unavoidable at certain times. I'm sorry that was your experience.
Yeah, the last time I was there, I was in a position to go to care plan meetings. So in the room with middle managers like nurse managers, uh, care team folk, mid-level providers, and they're fairly consistent that in being open about their experience working there as permanent employees, that they wouldn't send their kids, they wouldn't recommend it. Maybe 10, 20 years ago, it was a place for generations of families to work there successively. A parent works there, a kid works there, their kid works there. But from some change occurred that has, in their words, really taken the organization downhill precipitously.
When do you think that happens?
I don't know, but that was just sort of a generalization that they were able to provide. It could be some. It could have something to do with funding. Could have something to do with management, like the
Hmm.
practices of how the bosses, whoever's the boss in the big
Sure,
wigs, that was
sure.
the vibe that they conveyed. How's the pay?
Well, and I'll be honest, I'm happy to share the comp package with you because it's obviously a lucrative assignment because of the acuity level. But I think that everything that you just listed can also unfortunately happen with any hospital or with any inpatient setting like that because I think that these facilities go through ebbs and flows, like you said, of different management or changes that may happen. It's just unfortunate if you're there during one of those, ebbs. You'd rather be there during one of the flows where things are going well and operating smoothly, and they're not having to deal with, um, complaints from their own full time staff that they're concerned for their safety or, uh, you know, I don't think anybody wants that, but I just think that there's the potential for that to happen anywhere that you go. So even though maybe it was a negative experience or a negative time frame when you were there, all I'm saying is that I do think that there's the possibility that maybe things have improved. You said it's been a couple of years. Maybe things have improved. Maybe they are worse. I couldn't tell you. I'm not there on site. But it sounds like you have most likely zero interest in returning there.
Well, let me. I gotta
Um,
run for just a minute. Let me call you back in a bit, and we can
yeah, call me back. I can't wait.
talk about the pay and stuff.
All right. Bye bye.